Hey guys, it's Marshall with PhysioU. I'm here with Natalie, and today for the Mentoring Minute, we're going to talk about non-arthritic hip pain. So in the guidelines for the APTA, they have some good evidence that suggests they know what it is. So it's related to labral tears, FAI, impingement, stuff like that. They also have some good evidence that suggests how to assess for it. So for example, looking at seated 90 degrees, hip external rotation, hip internal rotation range. We'll look at strength in a second. And there's good evidence to suggest we know the impairments. However, when it comes to management, there is not really any good evidence on how to manage these patients, whether it's the strengthening, the control, just the evidence isn't there yet. So that's kind of where hopefully we'll get to in the future. Now, when we talk about assessment, there's an article that came out that looked at hip internal and external rotation in sitting at 90 degrees, and then again in prone at hip 0 degrees. And what they found was there's a correlation between those that had excessive hip internal rotation compared to muscle strength. So if I ask Natalie, kind of hold this here for me, don't let me push you down. So looking at internal rotation strength, good. And then let me go all the way over here, hold that there, right? Hip external rotation strength. There's a big correlation in those that had excessive hip internal rotation mobility had a limitation in hip external rotation strength compared to those that didn't have excessive hip internal rotation. So for this patient population, we're looking, do they have excessive hip internal rotation? Is it like there is no end feel? And then comparing it to their strength of the external rotators, there seems to be a correlation there. When it comes to management for treatment, the guidelines do say focus on hip abduction and external rotation strength and stability. So we'll go through a progression of a couple exercises that I like to work on. All right, one would be just typical clam. Right, so feet together, knees stacked on top. Right? You're going to lift your leg up towards the ceiling. Right? And some of the key things we look for is one, does she have any pelvic rotation backwards? If she does, I'm going to even emphasize pushing her forward. I can start by holding her back there. Go ahead and lift this leg up. Good. And back down. I can progress to then actually pulling her backwards, and she has to fight me to maintain that. Good. I'll have her do a couple of reps, focusing on an activation component. So it's going to be slow concentric, hold for isometric, slow for eccentric. So not just ripping them up off there. Good. If she's feeling it in the right spot, in the glute med, fantastic. If she isn't, let's say she's feeling it in the QL, I may need to place a towel or pillow under her side to help make her pelvis more perpendicular. Okay. So do a couple more there. Good. If she's feeling it more in the TFL area in the front, which is going to work some in the clam, right? It is an abductor. Go ahead and do that again. But if she's feeling more there, I can change the angle of her knees or even place her foot, one of her feet down. So hold that there. Good. Rotate you forward and then lift up again. Right. Work it on. Try to turn that off as much as you can. Good. Try to pull with the hip. Good. And down and up, 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 up. Good. And down. Right. Then we can always progress from just a regular clam to add a TheraBand. Right. Add some resistance. Good. And as we add resistance, we want to make sure that form doesn't change. So she's rolled forward. Go ahead and lift that knee. Good. Hold that, and relax. Good. Come back up. Hold it. As you think about extending your knee towards my finger forward, this way. There you go. Even more. Even more. Good. That way it helps keep her rolled forward and back down. Good. The next progression would be having her go into a side plank. Right. So go ahead and lift yourself up on your forearm. Good. Now we're having to stabilize the trunk. She's not resting. And remember, your pelvis is half of your hip joint, so her abs are controlling her pelvis. You can do that clam. Good. And down. Good. Slow concentric. Hold for the isometric. Slow eccentric. Good. Every time she lifts, want to make sure her pelvis doesn't drop down or rotate. Fantastic. Good. And relax. Good. I do like that. All right. Next one on the table will be in quadruped. Okay. And so again, you can do it without the TheraBand first and then add the TheraBand. Okay. I'm going to cue her to go into extension first. So going to kick backwards and then externally rotate. Okay. And as you see here, she has a little bit of pelvic rotation during that rotation. So again, I'll cue her again. So try to keep this stable. I may hold her just so she gets an idea what it feels like. Extension first, then rotation. Okay. Good. All right. And what it shows, if you do extension first, then rotation, you have improved glute max activation versus going into external rotation abduction first. Right? So just kind of focus on glute max and then get the rotation. Good. Perfect. We progress from the table to standing. right? We're gonna start with kind of what's called the Brugger's wrap. So go ahead and step on that with your feet. Cross it over the front of your ankles. Go behind your knees, and it's crossed. Good. Up over your thighs, cross again. And you kind of hold your hands on your hips. So you have it under your feet, crossed just below the knees, and then crossed at the hips. Okay. So go ahead and go into a squat. And remember, these patients won't be able to squat very far because of hip pain. So as long as we get a decent hip angle where we're activating glute muscle, we don't have the knees diving so far forward or diving in. And that's where this band is helpful. The band kind of cues a sit back, open up position. Right? And so you can start by just having her stand and hold this. Right, good. And kind of come back up. All right, drop back down. A progression could be then to start leaning towards the right side, so she's waiting, she's loading. We want to make sure as she shifts over, you don't overshift where her big toe comes up. Right? You need to make sure her first ray stays down, shift over. Now she's loading the right hip more. Hold it, hold it, hold it, go back. Okay. Another progression could be as she holds it, start lifting the heel on this side. Perfect, good. Up and down. We can progress to even now stepping your foot in and then stepping it back out. Good, back in, back. And the whole idea is this leg should be nice and stable, hip should be stable, shoulders should be stable. We don't want to see a lot of lateral shifting compensation. Good, come on up, take a break. Good, all right, back down to your squat. Shift towards me, hold it, knees out, nice trunk, good, step in, step out. Good, 1, 2, perfect. Now we can progress to even side steps, so side step that way, and then together, that way, together, back towards me. Remember, we want to make sure that the trunk is nice and stable. We don't want to see a lateral shift. Good. Good. Perfect. Back this way. And always making sure, if you keep this and turn sideways, right, fix your feet good. Remember, we're always looking at this hip angle. We want to make sure she's in a deeper hip angle than knee angle to kind of get more glutes over quads. Granted, your quads are working, right? You can't squat without your quads, so it's good. It's just making sure we're focusing on this abduction and extension motion. Come back up, take a break there. All right. If we progress from double limb to single limb, so go ahead and take that band off. All right, we can now change our wrap to go just around one leg. Do that. And wrap it across her body, so it's pulling. It's going to pull her femur into internal rotation. I'm going to hold that there. Good. All right. Then go ahead and kind of just step forward just a tad. Good. And then lift this leg in the air and go to like just a gentle mini squat. Very little. You don't have to go very far. Nice. Hold that. Good. So we're working on balance and stability as well as good control. Make sure she's in a hip angle. Good. Right. We can just make it harder for the proprioception and balance just by having her swing her opposite arm, kind of like she's running. Right? If she's a runner, make it a little bit more sport specific. Good. Nice. Keep that knee out. Keep the big toe down. Perfect. And come on back up. Take a break. Good. And the last progression we can work on is rotational control, since that's what tends to be one of the problems with these non-arthritic hip pain patients. So go ahead and do that squat again. Good. Remember, keep your knee facing forward. See if you can turn your opposite hip and pelvis all the way to the left like an airplane. Good. And back. Good. Let your trunk go with you, shoulders, chest, everything turns. And back. Good. So this is staying nice and stable. She's opening up and back down. Fantastic. She's working on good control on the right hip. And relax. Take a break. Awesome. Thanks for joining, guys. Hopefully you guys learned something about non-arthritic hip pain and how to try to manage these patients. Take care and see you next time.